Good evening. Honored graduates, faculty and staff, family and friends, as Chairman of the Board of Trustees of Nash Community College, I am pleased to bring you greetings from the board and welcome you to this pinning ceremony. The Board of Trustees is comprised of 12 men and women who are appointed and are charged with the responsibility of setting educational policy that is in keeping with the mission of the college and that will benefit the students who enroll in our programs. This is a major responsibility for many of our graduates who will be the workforce that will serve us well into the next century. Of all the programs we offer, there is none more important than our nursing program. The students who honor this evening will serve us in hospitals, clinics, physician offices, home health care, nursing homes, and in industrial settings. They are truly dedicated to the healing process, and they are deserving of the recognition we give them this evening. As board chair, I am confident that we have provided them with adequate resources, quality instructors to guarantee their competency. Speaking for the entire board, I offer my heartiest congratulations for their achievement and wish them the best as they begin their journey in their honored profession. Thank you.
Thank you, Mr. Chairman. Good evening. I'm Bill Carver, President of Nash Community College, and it gives me a great deal of pleasure to be part of this ceremony this evening and to honor our soon-to-be graduates tomorrow, but nurse graduates this evening receiving their pin. You met Mr. Dickens, our chairman, and I'd like to also introduce a few other of my bosses who are present with us tonight. These men and women volunteer their time. Students and faculty, you don't always get to see the board as much as maybe as I do, but believe me, they're one of the hardest working boards in the state. And Sam Dickens, our chair from Rocky Mount, Wayne Outlaw, if you don't mind, if y'all will stand. Wayne Outlaw, Catherine Wiggins Fisher, Mary Wells, Danny Tyson, C.E. Sonny Foster, and Mr. Bill Marshman over there trying to hide from me, so thank you. Of all of the programs that Nash Community College offers, the nursing program is one of our most important. I'm not going to say it is to the nurses here with me this evening and in their caps. It is the most important program for them. However, and believe me, they have studied hard, done a lot of hard work. I don't see you all the time, but I hear about you. I know what's going on over there. And I have been doing this job for about 10 years now, and we spend a lot of time on nurses. We are very proud of the job that we do and the resources that we spend to make sure that you get to this point this evening. And it is with great deal of pleasure that I have the honor of the nursing faculty that's seated behind you. That's not my job to introduce them, but I am very proud of the role that they do in getting you to this point. So the quality of instruction, the resources, and this pinning ceremony, very symbolic. Some schools don't do it anymore. We like a little tradition here at Nash Community College. Did we say thank you for choosing Nash, Dr. Mohrbutter? So you may have seen that around a few times. So thank you for choosing Nash, and I congratulate you on this point in your finishing up with us, but I know we'll see you some more. I run into nurses all the time. Sometimes it's embarrassing. I won't go into all that. However, we have brought back one of our own to give you some words of encouragement this evening. Renee Godwin Batts, Associate Director of Academic Programs at the North Carolina Community College System. And she probably will tell you more about her connection but she was once a nursing instructor here at Nash Community College. Prior to her current role, she was Director of Nursing at Longleaf Neurological Treatment Center in Wilson. She was an instructor here, and I was talking with her in the hallway, and she left us about 1989, I think, Renee. John, her husband, is part of the family too. I'm going to include him, right, Renee? We'll include John. He is also a nurse, and he is on shift tonight. I was a little disappointed, but we are filming this, Renee, so he can get we'll send him the electronic version. She works tirelessly across the state in making sure our nursing program in North Carolina is at the highest quality. So, ladies and gentlemen, it gives me extreme pleasure to present to you Renee Batts. Please, Renee, if you'll come and take over this podium for me. Thank you.
On behalf of the North Carolina Community College System, I bring you greetings. I'd like to express my appreciation to Nash Community College Board of Trustees, to the President, Dr. Carver, Dr. Trent Mohrbutter, Mike Latham, Dr. Tammy Clark, Ms. Cheryle Traish, the nursing faculty. A special thank you to the 39th penning or graduating class nursing students, to your family and friends for allowing me to share this special occasion with you. Now, one of the things that I was going to share as far as a personal story, Dr. Carver's already started sharing a little bit of it. I started I guess I would say my teaching career at Nash Community College. I was one of the nursing faculty here in 1982 and taught here for several years. And so Nash has a very special place in my heart. My husband, John, he also is a graduate of Nash Community College. He graduated with 2 different degrees here, physical therapy assistant, and then approximately 10 years later, he told me he wanted to make a career change. And I looked at him, I said, "What would you like to do?" And he said, "I think I want to be a nurse." So being the good wife that I am, I said, "Honey, why didn't you do that to start with?" So he came back here. He had Cheryle Traish, Becky Wise, and I'm not sure of any other of the nursing faculty that's still here that he had, but he graduated from here, went to get his baccalaureate online through East Carolina, and then came back later to teach here. So in saying that, please know that Nash has a very special place in my heart, and thank you for bringing me back home. But enough about me. Tonight we are here to celebrate you, your accomplishments, and this milestone in your life. Let's take a few minutes to reflect on this journey. When I say that, some of you may have thought all during childhood, I want to be a nurse when I grow up. Some of you may have thought once you reached high school and were in attending classes and looking at some of the classes, I think I may want to be a nurse. But for others of you, this may be a second career for you. You may have already achieved some academic accomplishments. You may have had a job. You may have been involved in starting a family and starting with children going to school, and you thought, I want to go back to school. So for whatever reason, I am glad that you decided you wanted to start this journey. Now, once you made that decision, let's talk about once you made that decision. You shopped around, you looked at community colleges, and I personally am glad that you chose Nash Community College. Once you made that decision, you had to start the process. Remember the TEAS test? All right. After the TEAS test, you were looking at those other admission requirements that you had to meet. You were taking courses to get points so you would be higher on the ladder with selective admission. You were looking at getting your application in on time. Then you received the notification that you were admitted into the program, and if you're like most of us, you did a happy dance. So then you got enrolled in school as far as nursing program. Your first trip to the bookstore, do you remember that? How many books you bought? The fact the books were as expensive as the tuition? Building up muscles, carrying those books. After that field trip to the bookstore, you went back multiple times, I know. You had your first day of attending nursing class. Now, I know nursing instructors are a whole different breed. You may have had classes in your biologies, you may have had English, you may have had your psychology, but remember the first day you met your nursing faculty. Now, one thing you may not realize is they see you as part of themselves, an extension. So they want you to do the best you can do. And when you graduate and the next day and you start working and they see you, they're going to be as proud of you as if you were their own daughter. Believe me, I speak from experience. So you met those nursing faculty. Then you started the labs, learning all about doing vital signs, learning about catheterizations, IV insertions. You started your clinicals. Remember the first day of clinical? How many of you are scared? Please raise your hand. Now, the thing about your first day of clinical, you were scared, but those people on the road behind you, the nursing faculty, they were scared too. I remember my first day as a nursing student, I remember my first day as a nursing instructor, and I was just as scared. So in saying that, you started going to clinicals. You were learning all of this, putting it all together. You were learning things like the nursing process, assessment, diagnosis, outcomes, making those short and long-term goals. You were looking at planning, implementation, evaluation. I don't know about you, but when I was in nursing school, it started me thinking about a whole different thing. Because instead of when you had a skint knee, saying, I have a skint knee, you had an alteration in skin integrity. You know, their blood pressure went up, alteration in tissue perfusion or alteration in the circulation, but you started looking at things differently. You also, if you were like most students, when you went over certain concepts and medical diagnosis, you may have gotten one or two of them. You know, you hear all about those symptoms, you go home, you start checking yourself for the rash. You start feeling around going, I don't think I have anything, but I don't know. You start listening to each other's chest and thinking, does this lung sound the same as this one over here? But that kind of goes along with nursing school too, doesn't it? We also start checking others that we love, looking at those moles. Does that mole look suspicious to you? Have you always had it? We learn words like biopsychosocial care. Remember that? Did you go home and you try it out on your loved one and they went, what? You learned about individualized care, that even though people have similarities, they have differences. And in saying that, just because you're taking care of someone who has congestive heart failure, that doesn't mean the person down the hall with congestive heart failure we can treat the same way. There are differences in their care. You were taught about interdisciplinary teams, looking at how you fit together with the other healthcare team. Quality care, evidence-based care practice. All of those are familiar terms to you, I know. Nursing school, as we know, is not easy. And you and your family made a lot of sacrifices for you to get to this point today. So first I want to say congratulations on successfully completing the nursing program. Now, I am going to try to keep this short tonight. My supervisor, before he left work today, he said, Renee, just remember, keep it short, just like you are. So, but I'm not going to let us end with the clapping, because I am very proud of you and congratulations for this accomplishment. But your next professional milestone, passing the NCLEX, the state board examinations, getting that RN license. Now, when you take it, you can get your results back relatively quick, right? 2-3 days, knowing. Well, I graduated from nursing school in the dark ages, okay? When I graduated from nursing school, they only offered state boards twice a year. And I think I probably have a few other people sitting out there like Becky and Cheryle that graduated from the dark ages. I don't know about anybody else. And with taking boards twice a year, you could take them in June and you took them in December. And because it was only offered twice a year, it was not online, it was paper and pencil test. Remember those exams, paper and pencil? We were able to practice as graduate nurses. Now, that's not something that you can do, as you know now. And we could practice as graduate nurses until we received our board results. And then it was either the happy dance, because we were now an RN, or the sad dance, because we weren't. So I had gotten my first job at Wake Med, and I was working as a graduate nurse. And it would take about 8 to 12 weeks for your board results to come back. Well, I got a phone call on the floor, and it was from my mother. She never called me at work. You know, people frown on you getting personal calls at work. And I was concerned because I thought something must be wrong. Well, she had gone to the mailbox, and guess what came? My notification in the mail. And it was a large envelope. That was important back then because that meant you got your big certificate. So she called me and she told me, Renee, your envelope came. And I said, well, is it a small or a big envelope? She said, it's a big one. I said, go ahead and open it. So she opened it. She told me, you passed. Well, here I was on the job, and I was working on a cardiothoracic floor, and the surgeon walked by about that time, and I was crying. And he said, what's wrong? And I said, I just got a phone call from my mother. He said, is everything all right at home? And I looked at him, I said, I passed my boards. I got a big hug, and he said, keep on crying, I understand. So the good news is you don't have to wait 8 to 12 weeks to get your board results back. But without having to wait that length of time, you'll be just as excited when you find out, yes, I passed. So let's talk about once you complete and you pass your first day on the job, orientation. It's like starting nursing school all over almost, because you'll go through orientation, you'll learn the way you're supposed to do things at that hospital or that institution or that nursing home, wherever you decide to work. And you'll be going to classes. Some of them will give you tests to take. And you'll feel just like you did when you first started nursing school and being on the floor. And that's normal. You're not supposed to feel all confident and sure about everything you're doing because you're in a different environment and in a different role. And you don't have the nursing faculty standing behind you, telling you exactly what you need to do. So in saying that, I want to say that as nurses, we are lifelong learners. Our ongoing continuing education may involve attending workshops, it could be attending seminars, or it could be seeking additional degrees, working on your baccalaureate degree, working on your master's, you're a nurse practitioner. Your education at Nash Community College has provided you a solid foundation to build your professional career as a nurse and any future educational endeavors that you make. Some of our healthcare employers today, as you know, have started requesting that new graduates upon hire complete their baccalaureate degree within a certain time period. The good news is, if that happens to you, the general education courses that you would need for that 4-year degree, you can obtain right here at your own back door at Nash Community College. And most of our university programs, when I think about the RN to BSN, there's 11 of them, have their programs online. So you can do it at home at your convenience. That's the way, as I said, my husband did it. As nurses, you will be able to work in a variety of settings. With over 100,000 RNs in North Carolina, we are by far the largest licensed health profession. We outnumber the doctors 4-1. Our healthcare systems are changing. An overarching goal with the healthcare is provide patients or residents, clients with more comprehensive, accessible, coordinated, and high-quality care, but at a lower cost. Emphasis being placed on primary and preventive care. Historically, the primary focus when it comes to looking for jobs has been inpatient or hospital settings, but recently there's been more focus on the community-based care, patient-centered medical homes, home health agencies, long-term care. Now, if I asked you right now to describe yourself as a nurse, you might use various adjectives: caregiver, care coordinator. Once you get some years under your belt, so to speak, you may be a care manager, an educator, because some of you may decide to do that, patient navigator, change agent, advocate, problem solver, researcher. There's a lot of ways we can describe ourselves. We've just completed Nurses Week. I hope you did something special for Nurses Week. You know, it was May 6th through the 12th. And so it seems very appropriate that we have pinning ceremony now. Now, I know one of the things that you did was study about some of our previous nurses in our history. So you heard about Florence Nightingale, you heard about Clara Barton, Mary Eliza Mahoney, Dorothea Dix, Lillian Wild. You know, those are some of the famous ones in history. You and I, or your faculty, may never be as famous as one of those historical figures. But please remember that each of you will have an impact on the patients, the clients, the families that you work with on a daily basis. As nurses, we are present during joyous occasions, and we're present during difficult times. Not only do you make an impact on the patient or the client that you're taking care of, but on their family and friends. Over the past 13 years, nurses have held the top spot as the public's most honest and ethical profession in America. Always remember the trust and belief others have in us as we go about our everyday duties is important to maintain. So here's my question to you. How often in life do you get what you want? Think about that. How often in life do you get exactly what you want, what you ask for? Okay? Ladies, this is what you wanted. This is what you've gotten. So now, what are you going to do with it? My charge to you is to provide the dedicated quality nursing care to others that you would expect to be provided to the people you love. Thank you.
Thanks, Renee, for those words. My name's Cheryle Traish, and I'm the Director of Nursing Programs here at Nash Community College. It is my pleasure to introduce to you the faculty who have played a role in these nursing students' education. Tara Ballard, Brittany Bass, Lisa Bass, Candace Bissett, Melissa Jones, Tywana Lawson, Misty Phillips, and Tina Traish, who could not be with us tonight. And I'd also like to especially recognize Becky Wise, who will be retiring after 30 years of service with Nash Community College Nursing. It's been a journey, guys. As we celebrate your accomplishments, I wanted to leave you with just a few thoughts. All around us are nurses, silent superheroes, who do and see the unimaginable. Some of it is amazing, so incredible that it would bring tears to your eyes, and some of it so horrifying that just thinking about it brings intense pain, even to the most seasoned of nurses. The best part of it all is that we have the ability to change lives every single day. Our job can be thankless, but it can also be beautiful and consuming, the kind of consuming that changes who you are, making you cherish the sunshine and gives you the strength to be a better person, a better nurse, one patient at a time. It's what we do. From the faculty here at Nash Community College, we wish you well as your journey now takes a turn, and we welcome you into our great profession of nursing. Thanks.
Tanya Edwards Armstrong. Christina Michelle Brake. Jasmine Renee Kennedy. Jody Michelle Colbert. Ogechika Ijindu. Tabitha Denise Finch. Heather Marie Fryer. Jessica Hobson Futrell. Tanya Sorry Hadnot. Erica Morgan Harrison. Whitney Latrice Horry.
There you go.
Kristen Marie Lafage. Sean Kristen Arrington Marshman. Caitlin Rayanne Nelson. Brenda K. Patton. Mickey Jean Richardson. Brandy Nicole Rowley. Angelica Jovanice Sampson. Samantha Jo Stump. Elizabeth Lane Walston. Candace Faith Williams. Brittany Ann Willoughby. Hillary Aaron Wilson.
Let's have a round of applause for this magnificent nursing class. If you'll please stay standing for the benediction. As we go forth from this place, we ask that these new nurses be supported and guided as they begin their careers, as well as throughout the rest of their lives serving others. We ask that they be given strength as they help others, and let the good that they do echo throughout the world. Amen.